What makes cortical stroke symptoms different? Imagine your brain as a busy control center, with different areas handling specific tasks. When a stroke hits the outer layer of the brain, called the cerebral cortex, it causes unique symptoms that set it apart from other types. These cortical strokes affect higher functions like language, vision, and awareness, leading to signs that are often more complex and varied. One of the clearest differences is the presence of cortical signs. These include aphasia, which is trouble speaking or understanding language. If someone has difficulty forming sentences or understanding words, it suggests the language areas in the brain are affected. Another sign is neglect, where a person might ignore or be unaware of one side of their body or space, often due to damage in the right side of the brain. Gaze preference or deviation is also common, where the eyes involuntarily turn toward the side of the stroke. Visual field deficits, like losing part of the vision in one eye or half of the visual field, are typical when the occipital lobe or optic pathways are involved. These signs show that the higher processing centers of the brain are disrupted, not just basic motor or sensory pathways. While both cortical and subcortical strokes can cause weakness or numbness on one side, cortical strokes tend to produce more complex motor problems. For example, a stroke in the middle cerebral artery territory might cause weakness in the face, arm, and leg, but also come with language problems or neglect. Subcortical strokes, like those in the internal capsule, usually cause pure motor or sensory deficits without affecting higher functions. Cognitive and behavioral changes are also more prominent in cortical strokes. Because the cortex manages thinking, memory, and personality, damage here can lead to trouble with attention, problem-solving, or even personality shifts. Some people might develop gait issues or become less responsive, known as akinetic mutism, depending on the affected cortical area. Knowing these differences is vital for doctors. Recognizing cortical signs helps pinpoint the stroke location, which influences treatment choices. For instance, large cortical strokes might be eligible for procedures like thrombectomy, a clot removal technique. Early detection of signs such as aphasia, neglect, or visual deficits can lead to faster intervention, improving outcomes. In summary, cortical stroke symptoms are marked by higher-level problems like language difficulties, neglect, gaze deviation, and visual field cuts. These signs reflected damage to the brain's outer layer, the cortex, and are distinct from the more straightforward motor or sensory deficits seen in subcortical strokes. Recognizing these differences helps ensure accurate diagnosis and timely treatment, which can make a significant difference in recovery. Always remember, if you or someone else shows signs of a stroke, seek emergency medical help immediately and consult healthcare professionals for personalized care.